All right, good afternoon, everyone. I'm gonna let folks come in to our session today. As you know, I think if you've been here before, you know my name is Brandon Garrett, and I work at the National Minority Quality Forum. Each week, we try to provide insightful information in the healthcare space. This week is no exception. Before I turn it over to our president and CEO of the AKF American Kidney Fund, LaVarn Burton, just want to have a couple of quick announcements. As you know, this month is Minority Health Month. And so we're doing a lot in that space, including our summit that takes place on this Monday and Tuesday, April 29th and 30th in Washington, D.C. If you happen to be in D.C. and want to stop by, we'll put a link to register for the summit in the text in the chat box. And then two, if you go to our website at nmqf.org, you can pull up links to watch the summit on Monday and Tuesday for just like as this. Now, what makes the summit so special this year, I think, is that one, we've been in NMKIP has existed for over 26 years now, and we're on our 25th summit. So we've been doing this education and helping out for a while. And then two, we have people like our organizations like the American Kidney Fund that's working with us. And then on April 30th, they will be doing their own panel and presentation similar about today's topic as we have APOL awareness and APOL1, sorry, awareness. And I can only talk so much about it, but the real expert is Ms. Burton and her guests. And so I will turn it over to LaVarn, who will also be presenting at our summit on Tuesday the morning of Tuesday, April 30th. So this is just a good old preview before we get to Tuesday's action. So without further ado, LaVarn.
Thank you so much, Brandon. And good afternoon, everyone. I'm LaVarn Burton, President and CEO of the American Kidney Fund. First of all, I want to welcome you all, and I want to thank the National Minority Quality Forum for the opportunity to lead this afternoon's discussion about APOL1 Mediated Kidney Disease, or AMKD. Before we start, though, I want to take a moment to extend our great sympathy to the family, congressional colleagues, and staff of Congressman Donald Payne, who passed away earlier this week. Congressman Payne was a tireless advocate for people with chronic diseases, including kidney disease. Over the years, he spoke at many AKF events and shared his personal story. We're grateful to have known him and for all of the work that he has done. And now, I want to tell you a bit about the American Kidney Fund, where our mission is to fight kidney disease and help people live healthier lives. We fight for kidney health for all through educational initiatives that address early detection and management, as well as health disparities in kidney disease. We work to raise awareness of kidney disease, including the financial burden on patients and families, and we advocate for policies that improve health outcomes for kidney patients, as well as promote the need for more kidney transplants and innovative new treatments. Our work on health disparities is especially important. The United States has a kidney disease crisis. The prevalence of kidney failure in the U.S. rose 35% between 2010 and 2020, making kidney disease the fastest growing non-contagious disease in the country. And people of color are disproportionately impacted by kidney failure. This brings us to today's topic, APOL1 mediated kidney disease, AMKD. AKF is very proud to launch the first ever AMKD Awareness Day on April 30th, 24. And we'll do that next Tuesday at the National Minority Quality Forum Summit. We hope to build awareness about AMKD, especially within communities at risk. Each of you listening today can help draw more attention to the under-recognized disease that is contributing to the high rates of kidney failure in the Black community. AMKD most often occurs in people with West and Central African ancestry. So we should all be aware that where you come from can affect your kidney health. AMKD is a genetic condition associated with variants in the APOL1 gene. Everyone has 2 copies of this gene, but having mutations in both copies is linked to an increased risk for rapidly progressing kidney disease that can result in kidney failure. People who are Black, African American, Afro-Caribbean, and/or Latino with ancestors from Western or Central Africa who inherited a certain variation of the APOL1 gene have an increased risk of developing AMKD. This is such an important topic, and that one that we look forward to talking about for some time to come, and especially next Tuesday. Today, I'm pleased to have with me Quentin Turner G., an AKF ambassador from Richmond, Virginia, who lives with AMKD, as well as Mike Spiegler, AKF's Vice President of Patient Support and Education. Our webinar today will be a candid conversation that will provide insights into living with kidney disease, as well as provide you with a deeper understanding of AMKD, this genetic form of rapidly progressing kidney disease. I encourage you to ask questions throughout the discussion and to take a look at the resources that we will share with you. So let's get to our conversation. Quentin, I want to turn to you, and I just so much appreciate how open you have been about your journey. Could you please share with us and with our audience your story about your experience with kidney disease, especially with AMKD?
Absolutely. So my kidney journey started, I want to say, in 2020, right when COVID hit. But it started way before then, but that's when it really progressed. So I was an athlete, a student athlete. I played football and I wrestled in high school, and I also played in college for a little bit. So I was never an unhealthy person. I worked out 3 to 4 times a week. I ate great and I drank a bunch of water, like they say to do. And I noticed that I started gaining weight, like a lot of weight. I got very lethargic. I was unable to keep my eyes open for long periods of time for a while, and I was always getting sick, constantly running to the bathroom, and it started affecting my work. So I got sick home from work one day because I was just really sick, and they told me that I couldn't come back without a doctor's note. So I ended up going to my local ER, and the ER wait was extremely long. So they did my triage, urine analysis, blood testing, and everything like that. They did the fingerprint for diabetes as well. And I asked them, when you get my results in, can you just give me a call? Because I can't wait 6 hours to see a doctor. And so what I did was I did that. I left. I had the paperwork showing that I went to the doctor, so I was able to go back to work. And I want to say maybe 2, 3 days later, I got a phone call from the nurse, the triage nurse. And she said, "Do you have a primary care physician?" And I said, "Well, no." I just turned like 26, and no, it wasn't 26. I haven't seen a primary care physician since I was 18, because I aged out of my pediatrician, and at that point I didn't know how to set none of that up. I was a kid. So I said no. She said, "Well, you might want to, because you have high levels of protein in your urine. Like, your urine is very cloudy, and that's not a good sign." Now, we didn't discuss what those signs may be, but she told me to get tested for diabetes. So I found a not pediatrician, I'm sorry. I found a primary care physician, and I set up an appointment, and I was seen by that primary care physician, and they started treating me. And things just started to progress more and more. I ended up getting hospitalized, and I was hospitalized for about a month. And in that month, I was put on IV diuretics, and I was given a Foley catheter. And that's where I got diagnosed with stage 4 kidney disease. It was the first time I even heard about, me possibly having kidney disease. And I was released, did physical therapy, and then I contracted COVID. When I contracted COVID, that kind of blew everything up. I was unable to be seen in office by doctors, which made it hard to do follow-up treatment from, the previous diagnosis. It made it hard for me to keep food down, medication down. things of that nature. So life goes on. A few months later, I end up getting pneumonia and COVID again. And I get hospitalized. And I'm in the hospital for about a week, and they're running my numbers. And at that point, nobody's talking about the kidney disease. So I leave the hospital, and it was the night before Mother's Day. I don't remember the night, but the way it was described to me, because I was incoherent and I was out of it. I was on the ground having a hard time breathing. I was unable to make comprehensible sentences. They couldn't understand what I was saying. My heart rate was so high when the EMTs arrived that they had to give me nitroglycerin in the field before loading me up. And they monitored me for, I want to say 48 hours to make sure that I didn't have any other cardiac issues. I was in an induced coma for 48 hours. In that 48 hours, they came to the conclusion that I needed to start dialysis immediately, and they discussed it with my wife, and she signed the paperwork for me to get a catheter, a central venous catheter in my chest to start dialysis. And I started dialysis, and I was on dialysis in the hospital 4 days a week until I could get as much of the fluid off around my heart and lungs to be able to breathe on my own. Because at that time, I was not breathing on my own. I was breathing with assistance. And eventually, things got better. And I ended up having to have a really hard conversation, because getting diagnosed with kidney disease, especially end stage, was like a kick between the legs. It was very, very shocking. And if you're not educated on kidney disease, you automatically think the worst. You think, okay, this is the end of my life. I'm too young to die. I don't have a lot of options. And it was an eye-opening experience. And from that point on, I started in-center hemodialysis. And I go to in-center hemodialysis 3 days a week.
Okay. Quentin, yeah, thank you so much for sharing that. We're following the story as it evolves. One question I have, up to this point, the triage nurse from the emergency room suggested that there might be some diabetes. Were you up to this point ever diagnosed with diabetes?
So I was not diagnosed with diabetes. The reason she suggested that is because I have a family history of diabetes. I have diabetes on my father's side and my mother's side. So there's a history on both sides. So she made the suggestion based off of my urinalysis and my family history. When I went to the primary care physician, instead of doing a full battery of tests, she basically kind of went off of what the paperwork from the nurse said and was treating me for diabetes, but that was making me sicker. It wasn't making me better, it was making me sicker. So I ended up switching primary care physicians after that.
Okay, that's really an important point. You know you're sick. Now they're putting you on dialysis. Talk about how you got to the bottom of what's really going on here. Were there struggles in your getting to a clear understanding? You're on dialysis, so you in kidney failure, but what's causing it? How did you find out?
So I asked a lot of questions. My father is one of my biggest advocates and supporters. My whole family actually has. And it just didn't make sense to me that prior to me getting diagnosed with kidney disease, I didn't have high blood pressure. I didn't have any issues with my blood sugar. So why all of a sudden did this hit me? Why is it this came out of nowhere and it progressed so quickly? That's another thing that stumped me, because I've seen people who are, living with stage 4 and are able to slow the progression down, but mine's progressed, it felt like overnight. So after being on dialysis for a while and constantly asking my nephrologist, like, hey, are there any tests we could run? Can we do a biopsy? And my nephrologist basically told me that because I was end stage and already on dialysis and my function was below 15%, there was no point in doing a biopsy because, my kidneys weren't coming back. And I wasn't satisfied with that. I joined AKF as an ambassador after my father introduced me to one of the grant programs that kind of helped me in that rough patch while I was waiting on my insurance to, kick in, and basically trying to figure out if I was going to continue working, feeling the way that I felt. And I joined one of I think it was a patient summit, and there was a booth, and I was listening to a lot of people speak about, their kidney disease and what they've been diagnosed with, IgA nephropathy, polycystic kidney disease, diabetic kidney disease, hypertensive kidney disease, and they all knew what caused their kidney disease. They all had an answer. And I'm just, shooting in the dark at that point. I didn't have a identity, and it was causing a lot of issues mentally for me, because what if there was a lot of what if questions in my head, and I just needed answers. So at a patient summit, there was a booth for genetic testing. And I sat in that info session and listened to them speak about it. And I got all the information that I feel like I can make an informed decision for myself. And I reached out. And after reaching out to them, we talked a little bit in that booth inside that meeting. And then we started emailing back and forth. And I was emailing with a coordinator, a patient coordinator, who got me in contact with a genetic counselor. And that genetic counselor set me up with my first genetic test, which was a saliva test. Now, that saliva test did not go well. It got compromised in transit, so it was unreadable. And at that point, they were like, okay, we'll send you another one, but this one would need to be a blood test, and blood tests have to be ordered by a physician. So I put my foot down, and I went to my nephrologist and I said, hey, look, I tried, because he asked me about the results, and I told him it was, it got deteriorated. And I said, all I need you to do is sign this paper. I need you to sign this paper saying that, you approved me getting this test, log into their website and put your medical ID number in so that they can run it through my insurance. And he did it. He listened to me, because my nephrologist wasn't one of those people who wasn't willing to hear. He just didn't want to give false hope. And now I gave myself hope, and he wanted to appease that. So he ordered the test, and they sent it out. They had a phlebotomist come to my house and do the blood draw, and the phlebotomist took the test, packaged it up, and shipped it off personally herself. And in a few weeks, I got an email from my genetic counselor saying that my test results were in, and my nephrologist would speak to me, and they would speak to me afterwards. My nephrologist came into my clinic that morning, and I've never seen him that early. And I've never seen him that excited. They got the mask on, so all you can see is their eyes, and he wears big bifocal glasses. And I've never seen his eyes so big and cheery. He said, I got some good news. And I was like, well, lay it on me. And he said, we got your test results back, and you have the APOL1 gene. And so me and him sat down, and we started looking at the test results. And I had the APOL1 gene, and I had two variant mutations. So I had the G1 mutation and the G2 mutation. And based off of that information, he said, well, this could mean that you could have a couple of different things, but if it's what I'm thinking, based off of your symptoms and your progression, I want to order a biopsy. So that next week, I went and got a biopsy done, which those are no fun. And I'm glad I only had to get one done. And that biopsy confirmed that I had FSGS.
Thank you so much, Quentin. and the relief of knowing what you had. Let me switch a little bit over here to Mike Spiegler. As we introduced Mike earlier, he's our Vice President for Education Patient Support. Mike, how does someone know that they've got kidney disease, and how important is it for you to know that you have it, and how important is it for you to know what caused it?
Yeah, great question. It's extremely important that you know that you have it, because there are, 30 years ago, there weren't a lot of options for people for managing their chronic kidney disease. There has been a lot of new innovations in the space for treatments and medications and trials that have really made a difference. So it's even more important than it was before to know that you have kidney disease. The challenge with it is that, you just heard Quentin talk about his situation. The symptoms didn't really start until he was pretty far progressed with his kidney disease. And that's the case with most people. 9 out of 10 people with early kidney disease do not know that they have it. It's very asymptomatic. The only way that you can know that you have a kidney disease are through tests for how your kidneys are doing. You can get that from your doctor. And one of the tests almost always happens as part of the annual physical. That's a blood test, which gives you a number called your estimated GFR or eGFR. But that's only going to find kidney disease from about stage 3 and onward. It's extremely important that you have that urine test that Quentin talked about to look for protein in your urine. That's how you're going to identify the early stages of kidney disease. And so once you know that, there are some things that you can do. You can see a nephrologist if you're moving forward. You can have some of the tests that Quentin talked about. But whatever it is, it's extremely important to know what caused your kidney disease. And that's for a lot of different reasons. I mentioned there's different trials. There's treatments now for patients to know what the cause of their kidney disease is. But if you end up getting a kidney transplant, you want to make sure that you know what caused that kidney failure, so that if you get a transplant, if you have a rare disease, it doesn't attack that kidney as well. I mentioned trials and treatments; those are important. But also family planning decisions. All of those things are really important for why you need to know the cause, and it's one of the things that we have taken on here at AKF as part of our Unknown Causes of Kidney Disease project.
Yeah, and Mike, what about AMKD? How would you know that you have it or that you're at risk for it?
Yeah. So again, Quentin talked about really the two main ways, which is a saliva test, a genetic test for DNA there, but you can also do a blood test as well. There are several different trials and ways to get that test that are free. Also, you can find those online, but really, we're trying to find those who are at high risk for kidney disease. And a couple of things that Quentin mentioned kind of play into that. He talked about how quickly things progressed, right? So, if you are a young person like Quentin and you are losing protein in your urine, that is not a normal thing. And seeing kind of fast progression. Dr. Olabisi, who's at Duke University, and he just published a JAMA article, yesterday on this. He did a presentation for us, which I think really describes this well. Is that if you think about kind of like a steam engine train for most people with their kidney disease, really when you have AMKD, it's kind of like a bullet train moving fast. So if you have kidney disease, you're spilling a lot of protein, you're seeing your kidney disease get worse and get worse quickly. Those are warning signs. AMKD, as far as we know, is not related to diabetic kidney disease or those that have damage to their kidneys from diabetes. So we're talking about those of West and Central African ancestry, which LaVarn mentioned in her intro. But I know lots of people don't really know what their heritage is. So if there's a suspicion there and you have some of the other qualifications, it's really important to talk to your family. And if you don't have diabetes, you already have kidney disease, it's really something to look into. And again, as Quentin mentioned, you have to have both of those gene variants on that APOL1 gene to be at risk. It doesn't mean you're going to develop kidney disease, but it certainly puts you at much higher risk, as Quentin talked about.
Thanks. And Quentin, we know that this is AMKD is genetic. I'm wondering if you could share with us family conversations that you might have had, and what was the reaction? How did you go about telling your family about this disease and the fact that it was genetic and how it might affect others, and how did they react?
So the first person I discussed it with was my dad, because he also suffers from kidney disease, and he's involved in the organizations. the way he took it is he kind of felt responsible, which is not his fault, because in order for me to have those variations and those mutations, it had to come from both parents. The next person that I really talked to was my wife, because I have a daughter, 6-year-old daughter, and that was always my concern, that I could pass my kidney disease down. So my wife is of Hispanic descent, and there are, situations where Hispanic people do, develop kidney disease. And so it's just something that we're keeping a close eye on. We've discussed it with her pediatrician on the right time to get her tested, which is generally after they start puberty. So around like 10, 12 years old, depending on, their physiology. But I also talked to my siblings because my sister, I don't really speak to her anymore. We had a falling out, but she has lupus, and she's had lupus since we were kids. And she's always, suffered greatly from that. And that was something that I feel like kind of affected me. And so when I talked to my brothers, my older brother, I discussed that he needed to get tested because, you never know how kidney disease is going to affect you. And you never know when it's going to affect you. Kidney disease is not racist. It's not biased at all. It affects all colors, ages. So I discussed with him all the things that I did to get tested. And here recently, he had a battery of tests done at his yearly physical upon my insistence. And yeah, and my other brother, he's gotten tested too. He's done the physical and the urinalysis. One of them's come back clean, the other one inconclusive. So it's just a forever conversation. But it's not just something that I talk about with family members either. We discuss it in everyday life. People at my dialysis clinic, I discuss, what I've gone through and what I did, and they might want to talk to their family about it too. The best way to get educated on kidney disease is word of mouth if you don't have a formal way to get that education.
Thanks very much, Quentin. And Mike, we know that AMKD is a fairly recent discovery by through some NIH-supported research, maybe a decade and a half since it's been discovered. Where's the medical community? What are they saying about this? Is the medical community, reasonably informed? And as somebody who might be concerned about this, whether or not I have it or my family has it, what kind of doctor would you go to talk about it? Where would you go?
These are all great questions. And I would say, with lots of new medical kind of knowledge, there's probably a lot of physicians that still are not very, very aware of AMKD. The good news is that, LaVarn talked about some of the energy that's around this right now. I mentioned the JAM article. Some of the other guideline bodies are putting things out right now, and we're trying to raise awareness about this. But it's probably something that, unfortunately, with like a lot of other things, especially when we talk about a rare disease, there's going to be some level of, unfortunately, some responsibility probably on the person, to the patient, to bring this to their doctor and have that conversation. We have lots of information on our website, which I think that was just dropped in the chat as well, about how to have that conversation with a physician. We recommend with any genetic test, especially that for AMKD, that you are also having a conversation with a genetic counselor as well. Genetic counselors are a great resource, either on the front end before you have the test, but certainly on the back end, so you understand, the risks going in for, anything that might happen from like an insurance discrimination standpoint, and then on the back end, what now and how to have that conversation with someone. Most people, if you're finding out you have AMKD, it likely means you already have kidney disease, so you're probably already seeing a kidney doctor, which is called a nephrologist. They're going to be probably more likely to know about this than your primary care doctor. But again, if you're looking to have that conversation with your healthcare team, I encourage you to go to the Kidney Fund website. We've got lots of information there about how to have that conversation and spark that up.
Okay, thank you. And Mike, we've been talking about people who are concerned about being at risk talking with their doctor, seeing a genetic counselor. What about people who want to donate an organ, living organ donors? Do they need to have any concerns about this?
Well, the first thing I will say is we are in desperate need of more living kidney donors, but also those that have put themselves on their driver's license as being an organ donor when they pass as well. So we need that tremendously. There are already huge disparity gaps in the Black community with transplants. AKF is doing a lot of work to try to help with that. So, it is a careful balance, and that we want to make sure that there are kidneys available. But of course, we also want to monitor that from the standpoint of living donors as well. It's going to be up to the transplant team. Our thing, and of course, with AMKD Awareness Day, which is on Tuesday, we're just trying to get awareness out about this generally. And anyone, even a living kidney donor, should know that this is something that they should consider. But whether or not they should be tested is really a conversation that they should have with their physician, with the transplant team before going into that and having that test done.
Right. Okay. And I just want to drop another kind of fact in here. We talked so much over the years about how kidney failure disproportionately impacts African Americans. Are 4 times more likely than whites to have kidney failure, not kidney disease, but kidney failure. And the importance of this discovery, this identification of the APOL1 gene and its impact is really, it's such an important door that's opening for additional research to understand why our community is so impacted by kidney failure. And I want to turn back to you, Quentin, because you've had a long journey, but you've been persistent. And successfully persistent in understanding what's going on. Did you feel at times that maybe you were educating some of the healthcare providers?
Most definitely. Like you and Mike mentioned, AMKD is something that's fairly new. So it wasn't something that a lot of people knew about. After I got my diagnosis, I definitely did my research because I asked questions and there weren't a lot of answers given to me. Not a lot of people knew about FSGS or the APOL1 gene as a whole. So upon me educating myself, it kind of encouraged my nephrologist at the time to get educated. And so me and him would bounce, information off of each other, send each other articles and things like that. He actually ended up moving his practice or moving his location out of my service area. So his colleagues are now my nephrologists. So now I have a whole team of nephrologists who are on my side. So 2 nephrologists that I see and 2 practical nurse practitioners. And they're very up to date, the nurses are. And it was ironic because you would think the nephrologists who went to school to learn about nephrology, the kidneys, would have more information than the nurses do. But because the nurses see so many patients inside the clinics and outside, they're 9 times out of 10 the ones who interact with the patients the most often in some practices. So they knew about AMKD. Some of them even sat on some panels and were, in some info sessions. So it's definitely a thing where I had to educate for majority, but they decided upon themselves to further educate so that if another patient comes in with similar genetic issues or, a similar diagnosis, they know how to treat, or they know how to provide preventative care.
Yeah. Thank you. Your story about your relationship and the back and forth between you and your doctor reminds me of another story I heard just a couple of weeks ago. Some of you may have attended our congressional briefing a couple of weeks ago where Alonzo Mourning came to town and we had a congressional briefing to talk about AMKD. And we may also recall that back when Alonzo was just starting his basketball career, and he talks about being in the Olympics and not feeling well. And he was not too long after that diagnosed with FSGS, the same thing that Quentin has. But he didn't, AMKD was not known in those days in the early 2000s, but it was in the constant back and forth conversations with him and his doctor and this new discovery about AMKD just a few years ago that he decided to go back and be tested. And he found out, you know, more than a decade after he was initially diagnosed with FSGS, that what had caused his FSGS was in fact AMKD. So this story is still, you know, it's still being revealed to us, and it's so important for patients and doctors to have that good and you know, that give and take until you can get to the bottom of this. Quentin, I want to ask you another question. You've been so active with the American Kidney Fund and other organizations and sharing your story. And, you know, I hope you don't mind my sharing that just this morning you had your dialysis, and yet you're here still working, telling your story. What motivates you? What keeps you so upbeat? What can you recommend to others who might be dealing with these serious chronic conditions?
My biggest motivation is my family. My daughter is my biggest cheerleader. She's my nurse, my doctor, my therapist, my everything. My wife is a big supporter. My father, my mother, and my brothers. Everybody is supporting me and pushing me to fight on. And so, in them giving me that energy allows me to find my motivation on a daily basis. Also motivated for the next generation, because I didn't have conversations about kidney disease, even though kidney disease was, you know, relevant in both sides of my family. Nobody discussed it. And so now that I have it, and I have a voice, and I'm able to stand on the platform that I'm able to stand on and speak on it, I want to make sure that nobody can say that there wasn't opportunities given to them for a better life. Because I hear a lot, just like you said, Alonzo, there was not the information that they had in the early 2000s. And kidney disease is a constantly progressing thing. And the technology and the education on kidney disease is also constantly progressing. So as long as I'm able to speak, and as long as I am able to be heard, I'm going to do my best to make sure that I advocate for others as well as my own family.
Okay, thank you so much. I think, Mike, I'm going to turn back to you for a second before maybe see whether we've got some questions from the audience. But in addition to talking to your healthcare provider, what else can a person do to keep their kidneys as healthy as possible?
Yeah. Well, I think a key word that Quentin just said there toward the end is advocate, right? I mean, advocate for yourself as much as you can. But when you're going to the doctor, first go to the doctor. If you're getting a physical, make sure they're doing both tests for kidney disease. Again, it's not just the blood test. Many people will get a blood test for kidney disease. You'll see that show up, you know, on your full lab report you get back. But make sure you're asking for the urine test as well. It's called UACR. That's really the only way to catch kidney disease at the earliest stages and give you the best chance for some kind of an intervention that you can take to try to keep your kidneys healthy. That is the number one thing. In addition, it's a lot of other healthy things. The magic bullets you heard on pretty much every disease state, right? It's healthy eating, it's exercise, it's avoiding tobacco. But it's really, you know, there are things now that are available to try to help keep your kidneys, even if you have early kidney disease, try to keep it where it is. It's not possible for everyone, but there are interventions now to do that. So it's really talking to your doctor about those two tests.
Okay. And Mike, talk a little bit about downstream side of it, the importance of prevention. What's the difference between being diagnosed as stage 1 versus stage 3 or 4?
Great question. So there are 5 stages of kidney disease, 1 being the earliest stage and 5 being at the point where most people will have to either start dialysis or get a kidney transplant. And, you know, getting a kidney transplant is the best treatment, but kidneys are, you know, there are 100,000 people waiting for organs in the United States. Kidneys aren't just coming from anywhere, right? It is difficult to get. And when you're on dialysis, it is a lot to take on. And I'm sure Quentin can talk about. I mean, it is, if you're going in center, it's 3 times a week at least for several hours at a time. You've got to get to the center, you got to get back from the center. You feel tired before, you feel tired afterwards. Some people do dialysis at home as well. But then, you know, you're doing dialysis pretty much every day of the week. So, I mean, it is a lot to take on. Many people can't work. Some do, but many can't. And it's just a huge toll on the whole body and the family. AKF is there to help with charitable assistance and some other programs that we have to help people through that. But our goal is to try to help people as much as we can not get to that point. And again, there are things you can do to try to slow the progression of kidney disease.
Mhm. Quentin, if you wanted to leave us with a thought from today's discussion, what are maybe the 1 or 2 things that you would want the audience to have to take away?
The biggest thing is have those difficult conversations. Do not be afraid to discuss health. If you're not feeling good, speak up. Don't be afraid to go to the doctor. That was one of the things that I was afraid of. I was afraid of going to the doctor because I was afraid of what I was going to hear. And that led me to the situation I'm in now, and I own it. Another thing is don't let it consume you. My kidney disease has not changed my life, but so much. It's made a lot of changes, but in the bad, there's also good. Without getting diagnosed with kidney disease, I wouldn't have met a lot of the people that I've met along the way. I've met a lot of great people through AKF. I've met a lot of people in my dialysis clinic. So it just don't let it define you. You define it.
Thank you so much, Quentin. And Mike, talk about some of the resources that we have, especially around AMKD, but resources that we have across the board with regard to kidney disease. And the more we have this conversation, even though I'm saying kidney disease, we're really talking about kidney diseases.
Yes, absolutely. So, you know, if you're listening to this and, you know, if you have any kind of kidney disease, as LeVarn mentioned, we really pride ourselves on fighting on all fronts for kidney patients. So from either if you're at risk for kidney disease all the way up through transplant, if you go to our website, kidneyfund.org, you will find things there. We have a website called Kidney Kitchen that has, you know, over 800 recipes that people can find to help, you know, make the changes to the way you eat a little bit easier. But for AMKD in particular, again, you know, April 30th, which is Tuesday, you know, lots of information on our website where you can learn do some social posts for us to try to get awareness out about that. Again, I mentioned, you know, for those that are patients or caregivers for someone, conversation guides for how to have those conversations, just some very simple videos on explaining what AMKD is. But for healthcare professionals, we also, for those that are listening, you know, that are providers out there, we have some webinars that we've done for healthcare professionals as a deeper dive into AMKD. That's an hour just in itself, just on AMKD, and also some guidance there as well. But, you know, to LeVarn's point, really, no matter where you are in your journey, we have education, we have financial assistance programs, we have healthy eating guides. Anything that you need, no matter where you are in your kidney disease journey, you can find on the website, which is kidneyfund.org.
Okay, thank you so much. Quentin, Mike, any closing remarks that you want to add? Anything that we might have overlooked talking about?
I don't think so.
Okay. Well, thank you. I don't see any questions from the audience, but I really hope that you will continue to follow us, follow this journey, and do use the resources that are there. I think the link to our website is in the chat section. And as we wrap up this afternoon discussion, I want to once again thank the National Minority Quality Forum for this wonderful opportunity, as well as the opportunity to present next Tuesday on what will be the very first AMKD Awareness Day. And also want to thank Congresswoman Stacey Plaskett for her sponsorship, lead sponsorship of the resolution for AMKD, and the many other people around the country, including here in the district government, who are really observing this day, which we will continue to observe every year on the last Tuesday of April. And I want to take a moment to thank Vertex Pharmaceuticals for their support of AMKD Awareness Day. And to just thank you so very much for joining us today, Quentin for telling his story, Mike for helping to fill in the background of what we need to be concerned about and what we need to do if we're concerned that we may be at high risk or even already have kidney disease. We really hope that this will be the first of many discussions about AMKD. And I encourage everyone to visit the website kidneyfund.org to learn more about the American Kidney Fund and APOL1 mediated kidney disease, and to just become APOL1 aware. So thank you again for being with us, and we're delighted to be able to lead this conversation today.